The morning sun filtered through the classroom windows as Dr. Sarah Martinez prepared for her most challenging lecture of the semester. Today, she would discuss pica, a complex eating disorder that had puzzled medical professionals for centuries. Her students, future psychologists, and medical practitioners needed to understand not just the clinical definition, but the human stories behind this condition. Pica, derived from the Latin word for magpie, a bird known for eating almost anything, represents a persistent pattern of consuming non-nutritive, non-food substances over a period of at least 1 month. This behavior occurs in individuals who have reached a developmental level where such consumption is deemed inappropriate, typically beyond 18 to 24 months of age. The condition manifests differently across age groups, making its identification and treatment particularly complex. Dr. Martinez began with a case study that had deeply affected her early career. 8-year-old Emma had been brought to the clinic by worried parents who discovered their daughter regularly consuming paper, starch, and paint chips. The family's distress was palpable as they described finding Emma secretly eating these substances, despite repeated attempts to redirect her behavior. Emma's case illustrated the most common demographic affected by pica: young children, particularly those with developmental disabilities or autism spectrum disorders. The prevalence of pica varies significantly across populations. Among typically developing children, the condition affects approximately 10 to 15% of toddlers, usually resolving naturally as cognitive development progresses. However, in individuals with intellectual disabilities, the prevalence can reach 25% or higher, often persisting into adulthood without proper intervention. Adults with severe mental health conditions, particularly those with schizophrenia or obsessive-compulsive disorder, may also develop pica behaviors. Understanding the underlying causes of pica requires examining multiple factors. Nutritional deficiencies, particularly iron or zinc deficiency, can trigger cravings for non-food items. The body's attempt to obtain missing nutrients sometimes manifests as unusual consumption patterns. Cultural factors also play a role, as certain societies have traditions involving consumption of clay, starch, or other non-conventional items during pregnancy or religious ceremonies. However, distinguishing between cultural practices and pathological pica requires careful assessment of context and consequences. The diagnostic process for pica involves comprehensive evaluation by healthcare professionals. Clinicians must rule out other conditions that might explain the behavior, such as anorexia nervosa, bulimia nervosa, or other feeding disorders. The consumption must be inappropriate for the individual's developmental level and not part of culturally sanctioned practices. Additionally, the behavior must persist for at least 1 month and cause significant impairment in functioning or pose health risks. Medical complications from pica can be severe and life-threatening. Consuming paint chips containing lead can result in lead poisoning, causing neurological damage, developmental delays, and behavioral problems. Ingesting sharp objects like metal or glass can cause internal injuries, including intestinal blockages or perforations requiring emergency surgery. Hair consumption, known as trichophagia, can lead to trichobezoars, massive hairballs that obstruct the digestive system. Clay or starch consumption might cause constipation, electrolyte imbalances, or dental problems. Treatment approaches for pica are multifaceted and individualized. Behavioral interventions form the cornerstone of most treatment plans. These may include environmental modifications to reduce access to non-food items, positive reinforcement for appropriate eating behaviors, and teaching alternative coping strategies. For individuals with developmental disabilities, structured behavioral programs have shown significant success in reducing pica behaviors while promoting safer alternatives. Nutritional assessment and supplementation play crucial roles in treatment. Healthcare providers typically conduct comprehensive blood work to identify deficiencies in iron, zinc, or other essential nutrients. Correcting these deficiencies through dietary changes or supplements can significantly reduce pica behaviors in cases where nutritional factors contribute to the condition. However, supplementation alone rarely eliminates the behavior entirely, requiring concurrent behavioral interventions. Family education and support are essential components of successful pica treatment. Parents and caregivers need training in recognizing triggers, implementing safety measures, and consistently applying behavioral strategies. Support groups can provide valuable resources and emotional support for families navigating the challenges of managing pica in their loved ones. The prognosis for pica varies considerably depending on several factors. Young children without developmental disabilities often outgrow the behavior naturally as their cognitive abilities mature and their understanding of appropriate eating develops. However, individuals with intellectual disabilities or severe mental health conditions may require long-term management and ongoing support. Early intervention generally leads to better outcomes, emphasizing the importance of prompt recognition and treatment. Prevention strategies focus on creating safe environments and promoting healthy eating habits. Child-proofing homes to remove access to potentially harmful non-food items, maintaining adequate nutrition, and providing appropriate supervision can reduce the risk of pica development. For individuals at higher risk, such as those with developmental disabilities, proactive behavioral programs and environmental modifications can prevent the establishment of dangerous consumption patterns. Dr. Martinez concluded her lecture by emphasizing that pica, while challenging, is a treatable condition when approached with understanding, patience, and appropriate professional support. She reminded her students that behind every case of pica is a person deserving of compassionate care, not judgment. The complexity of this condition requires healthcare providers to look beyond surface behaviors and address underlying causes while prioritizing safety and dignity in treatment approaches. As the students filed out of the classroom, many approached Dr. Martinez with questions, reflecting their growing understanding of pica's complexity and their commitment to providing compassionate care for individuals affected by this often misunderstood condition.